The debate over health care reform rages on.
Changes continue to be made to the plan in Congress, including talk of compromises in order to win legislative approval. But the premise of the Democratic plan is affordable health care that also controls the cost. All this week, Fox 11 News will take a closer look at the plan by talking in depth with our Northeast Wisconsin Congressman Steve Kagan and Tom Petri. Tonight, your health care checkup focuses on the cost of the reform plan. The government reports roughly 46 million Americans have no health insurance. Their costs often become a burden to others in the system through higher insurance premiums and medical rates. The intent of the health care reform plan aims to change that by promoting wellness, prevention, and competition, and overall stabilizing costs. But at what cost?
It's a big budget buster. Where will the money come from?
Republican 6th District Congressman Tom Petri points out the Government Budget Office estimates the cost of the House bill under consideration at nearly $1 trillion over the next 10 years.
It can't be that we're all going to send the bill to Uncle Sam, because there is no Uncle Sam. At the end of the day, we're all behind the other side of that curtain, and then we've got to pay it back.
Democratic 8th District Congressman Steve Kagan acknowledges the cost to implement reform, but says savings through better efficiencies in preventing waste, fraud, and abuse of the system will offset that amount.
I think we can drive down the cost of insurance premiums by creating a larger purchasing pool for small businesses. I want the insurance companies to begin to sell a standard insurance policy, an insurance benefit policy that becomes a federal standard.
The plan also calls for a surtax on the wealthy, those making over $350,000 a year, to bring in hundreds of billions more.
If there are efficiencies to be achieved, maybe what we should do is realize the efficiencies first and then use those dollars to expand coverage and so on.
Both congressmen point to ThedaCare, Center for Healthcare Value in Appleton, which has been successful in rewarding providers for delivering quality care at lower costs for its patients. Kagan says it's a model the reform plan should embrace to lower costs.
Some estimates are that the insurance premium might come down by 20 to 22%.
While Petri says ThedaCare proves major government reform is not needed.
That's how the market works in a lot of other areas, and we really need to be moving in the direction of making that work more effectively in the healthcare area.
Now, both congressmen tell me cost will be one of the biggest stumbling blocks when it comes to approving some sort of bipartisan agreement on health care reform. A lot of the numbers being tossed around out there, but what's needed are fewer estimates and more specifics on actual program costs and savings. Well, tomorrow night, your health care checkup on the reform plan will take a closer look at the coverage the plan hopes to provide. Will you be in, or will loopholes keep you out? And you can find full coverage of your health care checkup at fox11online.com. There's a complete archive of all of our stories there. Links including one where you can read the full bill and a poll to let us know where you stand on the health care bill. You'll find it by holding your mouse over news and then clicking on health.